Good day, everyone. This is Janine P. Ilagan, and I am here to discuss to you what is celiac disease. So, celiac disease is a type of gastrointestinal problem wherein your small intestine could not absorb the right nutrients. Therefore, the person that have this disease is malnourished. These people could not tolerate gluten. Gluten is a certain type of protein. When a person ingests gluten, his villi are damaged. With damaged villi, a person will not receive the right nutrients no matter how much food he ingests. To explain further, villi are finger-like projections. These finger-like projections serves for absorbing the nutrients getting into our body. After absorbing the nutrients, the villi will the nutrients will go to the bloodstream for our body to utilize. So the other terms for celiac disease are malabsorption, celiac sprue, non-tropical sprue, gluten-sensitive enteropathy. So the other terms for celiac disease are malabsorption, celiac sprue, non-tropical sprue, and gluten-sensitive enteropathy. Celiac disease could be inherited, or it runs in the family's blood, or it could be triggered by undergoing surgeries, having viral infection, stress, or other factors. The symptoms of celiac disease in children and adults varies. For children, you could expect for abdominal bloating or pain, chronic diarrhea, vomiting, constipation, foul smelling or fatty stool, and weight loss. For the symptoms present in adults, presence of unexplained iron deficiency anemia is very notable. You could also expect for fatigue, bone or joint pain, arthritis, bone loss or osteoporosis, depression or anxiety, tingling numbness in the hands and feet, seizures, missed menstrual periods, infertility or recurrent miscarriage, canker sores in the mouth. Presence of dermatitis herpetiformis is also a big factor of this. It is a type of itchy skin rash. Celiac disease is also accompanied by other health problems. So if you have type 1 diabetes, it would be accompanied by celiac disease. It is also applicable with the autoimmune thyroid disease, autoimmune liver disease, rheumatoid arthritis, Addison's disease, which is a certain type of problem wherein the glands that produce critical hormones are damaged. We also have Sjogren's syndrome, which is a condition wherein the glands that produce tears and saliva are destroyed. To determine if you have this disease, you could perform certain blood tests, intestinal biopsy, wherein tissues of your intestinal organs, or specifically the small intestine, will be taken out to be analyzed. Then, looking for the presence of dermatitis herpetiformis and by simply screening. Once you find out that you have this disease, the only treatment is the gluten-free diet, wherein you will stop eating foods with gluten. So the foods that are allowed to you are potato, rice, soy, buckwheat, bean flour, plain meat, fish, rice, fruits, and vegetables, and also tapioca. Foods to avoid, or the foods that you should not eat, are preserved foods, grain, pastas, cereals, processed foods, and wheat flour. Once you had adhered to this diet, there is a great possibility that the damaged villi will heal and further damage will be prevented. So, for additional information, if this disease is left untreated, there is a really big possibility that it will lead to anemia, osteoporosis, or even cancer. If you find out that one of your family member is affected by this, you are advised to consult the doctor and have yourself tested. Because, to remind you, celiac disease is an inheritable disease. This disease is lifetime. So you have to maintain a gluten-free diet as long as you're living. So thank you very much. This is Janine P. Ilagan.